Hello, I welcome you to this lesson where we're looking at nursing care in different conditions and different specialties. Today, we are looking at nursing care for surgical patients pre-operatively and post-operatively. And within this lesson, I would want also to emphasize the nursing theories that can help the student come up with the nursing care. So we have nursing theories like the environmental theory by Florence Nightingale. We have Abraham Maslow's high lack of needs, also that can help us to build a nursing care based on those needs. We have the conservative theory, we have the Elkinson's theory, we have the aspect of care, or that is core and cure, the aspect of care, core and cure. We have the Roy adaptation model. We have H. Papro's interpersonal relationship theory, and we have Virginia Henderson's nursing need theory. We have the Jean Watson theory of human caring, and all these theories are there to help us build nursing care, build the knowledge on how to nurse a patient. All right, so pre-operative care, this is the care that is given to the patient before they go for surgery. And students have helped me come up with something that is easier to use when you want to write an essay or you want to plan for the care for the patient. So we are calling it the A, B, C, D, E, F, G, H, I, J, and then we have NPO. All right, so A is for airway. So now if you see, I have A, B, C, D, and on D, I've put an asterisk there. Put an asterisk there because the A, B, C, D, those are required in an emergency. They're required in an emergency, and for each emergency that you're writing, you need to talk about airway, securing airway. You need to talk about breathing, observation, to see that the breathing is okay. And then C is for stands for two things: circulation and consent. Circulation and consent. So C in emergency, we are saying check blood circulation. Blood circulation is there. If are there any problems so that you can institute the necessary measure in terms of drugs to give before D you dispose of to the hospital. Dispose meaning you refer patient to the hospital. So D is for drugs. There are drugs that you can give post-operatively. All right. So now let me do a recap on these things that I'm saying they are found in emergency. So A is airway. You have to ensure that there's no blockage within the airway. Patients should just be breathing very well because 4 minutes without oxygen to the brain cells may start dying. So ensure that there's nothing blocking the airway. Then breathing. You have to observe breathing that it is normal pattern. You can observe by also use of machinery like the pulse oximeter, which looks at the saturation of oxygen in the blood. All right, so then we have C, which is circulation. So C is for blood circulation, like you take blood pressure, you take pulse, so that you can note the circulation. Okay, then for any operation that you have to do on a patient, you are required to take a consent. And you can only take consent if you have done the psychological care you have explained to the patient. So if you've seen there's NPO there, we have psychological care there. I'll come to that. So consent signing. Here, what I'm trying to say is that this is not arranged in any chronological order. You can change the headings whichever way you want. You can change your planning depending on the situation. So C is for circulation, check for pulse, check for blood pressure. And then you also need to take consent. There are ages according to your country that you need to consider when you're talking about consent signing. Maybe the age is 18 for someone to sign their own consent, or maybe the age is 21 in your own country for someone to sign a consent. So you have to follow that. If the patient is too young, cannot sign, then an alternatively, someone who is caring for this someone who's caring for this patient or for this client can sign, and this can be a family member and the likes. So D is for drugs. So there are drugs that are given pre-operatively, and mostly they are given to allay anxiety. Like we have the diazepam that is given to allay anxiety, and it also helps to reduce the amount of anesthesia that is used. Other drugs that can be given is to stop the nausea that may come because the patient was using the theater drugs or was on theater drugs. So you can give those drugs to avoid nausea so that the patient does not vomit on the theater table and the likes. Okay, so the other drugs that can be given actually are for dry secretions like atropine, but you have to note, please, the nature of the surgery or the type of surgery here matters a lot. Okay, so D, we are saying drugs. You have to give drugs pre-operatively. I can also add that you can also give antibiotics. Prophylactic antibiotics can be given in order to avoid infection post-operatively. Okay, so on drugs, I think we are done. Then elimination. So elimination for certain operation, patient needs to go with an empty bladder so that there are no injuries to the bladder as the surgeon is trying to access certain organs. So elimination is important because you also for hygienic purposes. Yes, so for hygienic purposes, we don't want some cross infection because the patients' bowels are affected by surgical drugs that may lead to paralytic areas. So it is important the bowel is washed out or the elimination part there, you take care of it in a nursing way so that patient does not end up having complications. All right, then if we assign that for fluids, and these fluids here we are saying put up a cannula for administration of drugs during theater or administration of fluids, because patient may lose a lot of blood and may need either blood transfusion or may need just fluids, plasma expanders to help them balance the electrolytes within their body. Okay, so F is for fluids, and please, as I'm delivering this lesson, I know you have some background knowledge of other things that you feel you can still put in or you can still add. So I would appreciate comments you put in there so that others can also benefit from those things that you feel have been omitted. All right, so G is for gown. The patient is given a theater gown to prevent cross-infection, and this is a sterile kind of dressing. It's a sterile dressing that the patient is given. Okay, so there is a theater gown that we actually give the patient. So that is the gown part. Okay, and then H is for hygiene. So hygiene constitutes that the patient should be cleaned before they go to theater to prevent cross-infection. Patients should be cleaned. Ideally, they have to bath, they take a bath. This needs, according to surgeons' preference, to shave the area within that area. Maybe there's some area that develops. We're saying you need to shave for hygiene purposes. Okay, there's some debate as to whether it's necessary to shave for cross infection and the issues, but all in all, we just know that the hair follicles may have some bacteria, so the less you have, more it becomes easier to maintain proper hygiene. Okay, so the other parts actually after hygiene, because it's alphabetically arranged. We are looking at I. So I is for identity. Provide an identity band to the patient so that we know the type of surgery that you want to do when you bring the patient to theater. So you have to put an identity band which will contain the name, age, okay, name, age, and even possibly the type of operation. You can also include if anything that is um, that is peculiar to the patient. Otherwise, each and every hospital may have their own system of writing their identity band. So that information is necessary on that identity band because the people who are in theater might not be so much familiar with that patient. So it becomes easier for someone in theater to easily identify the patient. and know the operation that needs to be done. So I is for identity band. Okay, so I is also for investigations. Prior to patient going to theater, there are certain investigations that need to be done, like full blood counts, so that we know that the patient, as they are coming to theater, they have the necessary hemoglobin levels. They are not anemic. Okay, you have to rule out infections and you have to do all that. So, investigations. All right, then J is for jewelry. Jewelry has to be removed to prevent electrocution, and we also know that it can also be a source of infection. Oh, if you have some stone, this is some teeth that are made of uh, that are made of gold or anything like that. Those they can may dislodge during an operation and may block the airway. Okay, so jewelries have to be removed and secured nicely. Okay, so then we move on to NPO. Okay, so NPO, that is nutrition wise. If patient is not well nourished for certain procedures of operation, patient might be told to gain a bit of some weight. Or if patient is too obese, may be told to lose some weight. So nutrition part there needs to be taken care of so that we avoid complications. Okay. Then psychological care. So in psychological care, simply you educate the patient about the condition, you explain the condition, you explain what is going to be removed. If at all there's anything that will be removed, what is going to be repaired, you explain so that the patient is comfortable and understands what he is or what is what is being done or what will be done at that particular point. So psychological care is very important because you make patients become less fearful for the procedure. Okay, it's not easy to know that they will cut your body, they will be touching your organs and the likes. So it's not easy. So give the appropriate psychological care. All right, then O is observation. Observation actually is for all conditions. Observations are very important. So apart from temperature, pulse, and respirations, there can be certain things that are peculiar that you might need to observe during the period when the patient has been booked for theater. All right. So in a nutshell, this is the way you can nurse the patients before they go to theater. Never confuse it. Before they go to theater is A, B, C, N, P, O. A, B, C after J, N, P, O. All right. And then when you're talking about nursing of patients post-operatively, patients who you're nursing post-operatively will be in pain because the operation creates a wound. So there needs to be pain management, and most likely you might use opioid for a period of time, 2, 3 days when necessary, in order to alleviate that pain. Psychological care here is very important because there is an alteration in patient's anatomy or morphology. So it's important to give psychological care. Certain scars can be cosmetic. All right. So then we can now talk about observations. So observations about temperature, pulse, respiration, and blood pressure. But as the patient comes from theater, depending on the surgery, they may have some drains that you need to observe, and other things like urine output that you may need to observe, especially if the operation was extensive. So it's important you do the right observation and don't just stick to temperature, pulse, respiration. There is a lot to be done. All right. So then the next part is wound management. When a patient goes to theater, there will be a wound that is created to access the pathology inside the body. So, and I'm looking at this where we are doing all those surgical incisions to do the operations. But otherwise, even in these other new technologies, there will still be a wound that is created even inside the body and the likes. So there is a change in the morphology that needs to be taken care of. So wound management, so it should be managed appropriately, and we are trying to avoid infection here. when we're managing this wound. Okay, then the other part is exercises. Especially for abdominal surgery, it's important that the patient starts exercising early to prevent adhesions. So patients need to start exercising early. And most of the time, you observe that after a patient comes from theater after major surgery, um, the doctor will start feeling for bowel movement and the like. So elimination also becomes very important as a way of observing some of the key principal indicators of changes in the normal functioning of someone's body. Then rest helps someone to recover easily from the condition. In as much as we are saying exercises, you don't have to overdo it. So it's also important to rest to allow for healing. Okay, rehabilitation. Most operations, after the operation has been done, rehabilitation may be needed so that the patient can come back to the previous state of function. So rehabilitation is very important. Please, all these videos that we are posting about nursing care and other topics that we are yet to cover are free. So all you need is to subscribe to the YouTube channel so that every time we post a new video, you will receive a notification and listen to that lesson. And if at all you have benefited from this lesson, I encourage you to share with others so that they can benefit. Okay, I would also appreciate feedback in terms of comments and underneath this YouTube so that we can improve on our our production of these videos. So those comments they will help us to grow together so that our lessons may be more engaging. So subscribe, share, and always remember that we are there to help each other. We are there to build each other in as much as we are doing all these things. So for now, I encourage you to go and read the nursing theories and then you come back and look at these letters that I've given you in nursing a patient pre-operatively and nursing a patient post-operatively. I appreciate and thank you for listening to this lesson.